And before we move on, were there any undergrad takeaways that you wanted to share?
Be curious, and try out as many things as you can, no matter how crazy they might seem in the moment, as irrelevant they might seem to what your larger plans of what you're doing and how you want to do it. If you think something is intriguing, something is interesting, try it out. There is a learning opportunity everywhere, and don't underestimate those learning opportunities. I have learned the most unexpected things in the most unexpected places that have been lifesavers for me. And I think a lot of people can relate to that. So just try out as many things as you can, and let your heart and your mind and your creativity and your curiosity flow free. And also be observant. There is a lot of things going on, as you're a young person. There's a lot of things going on around you, and you have all of that energy and that potential. So just be observant, be creative, and let yourself feel and let yourself breathe.
And then you went on to pursue a Master's of Public Health with a concentration in Community and Behavioral Health from Colorado School of Public Health. Tell us about that thought process.
It was a lot more simple at that point because I had been doing Colectivo for, a year and a half at that point. I just gotten out of college. I was working in a public health role, and I knew that I wanted to learn a little bit more the scientific, like I said, the skills, the resources, gain some more of that experience. So I decided that I'd just do it. So it was a lot more straightforward. Colorado School of Public Health is such an amazing school. And even before I did my MPH there, I have had the opportunity to partner with some professors there. I had the opportunity to partner with several of their students, and I had seen the impact of their work in our community. And I knew that, that's the space I wanted to find myself in. So I applied, and and then that was that.
And while you were there, you had a couple different positions. You were the Public Health Administration and Research Intern at the Denver Department of Public Health and Environment. You were an Education Equity Scholar at the Morgridge College of Education at the University of Denver, and you were also a Community Outreach and Enrollment Director for Sheridan Health Services. Tell us about those experiences.
Yes, so I worked with the Denver Department of Public Health during the pandemic, and I got another term limited internship opportunity there. I had a great experience. I mean, very stressful, but a great experience working with the team there. And so I wanted to polish a little bit more of my public health, tools in my arsenal, flex a little bit more of my public health muscle, learn some more, on the field. So I did that, and then I got the opportunity so the Education Equity Scholar, it was back at DU's Graduate School of Education, which is a Morgridge school, was doing this program here in underserved high schools, specifically for neurodiverse young people. As a neurodiverse person myself, I wanted to just be a part of that conversation. And it was an after school program providing support on literacy, math, and science. And so I was able to be there, help out with some reading assignments, I love hanging out with the kiddos and talking, and they had so many wonderful insights about so many different things. It is. And on my last day there, actually, one of the students gave me a balloon that said, "Thank you, Mr. Sudev." And to this day, it's in my office. I always look at it every morning because they taught me just as much about public health as my professors did. And it is no shade to my professors. It's a huge compliment to them, actually, because these kids were some of the smartest people I had met, and they were so curious and so creative and so brilliant. And I always think, we have all these ideas when we are that age. We have all these passions when we are that age. And as we grow older, we teach ourselves to be realistic. We teach ourselves to, numb those edges. And
Right.
I think that is a great disservice to ourselves, because we rob ourselves of the opportunity to do truly wondrous, miraculous things that these kids, to them, it's just a Tuesday. But for us, we don't think that way. And so they taught me in a way to kind of, again, approach public health with that curiosity in mind. And it is a learning curve for me. I'm going to admit that it's a learning curve, but I am very glad that I got the chance to talk to them and work with them, because even though it was for just a few short months, I still take those lessons with me every day. And then with Sheridan, which is a federally qualified health center, it was again a term limited opportunity. It started out as my practicum for my MPH, but then I loved the office and the folks there, and they loved me, and we had such a great rapport that when they were hiring somebody for a term limited role for their community engagement and enrollment coordinator, they considered me, and I'm very grateful they did, because for the next few months I got to build out their community engagement and enrollment department. I got to design their mobile health unit. I got to work on their community health impact plan, their service area competition grant applications. So I got to do a lot of the administrative part of public health, which I had not gotten really the chance to work with to that point. So I got to, really work on a lot of those skills and hone those skills. And I think, again, like I was saying, try out everything. And I'm still doing that. And I hope I still am able to do it late into my career as well, that I'm able to experience, because health is such a multidimensional vector, and to experience working in healthcare from as many different angles as possible. Because as healthcare professionals, I think it's very important for us to develop a rounded understanding of health, disparity, equity, access, and look at it and tackle it from all sorts of different perspectives. And all of these opportunities that I was able to pursue while we're doing my MPH really contributed to that. Also, I did my capstone during my MPH on bullet injuries, so gun violence and bullet related injuries, which is completely different. During the day I was working with elementary school and preschool, kindergartens. During the day I was working with with the kiddos, and then I would spend several hours after in level 1 trauma centers working on bullet related injuries and thinking about. So I was working to see possible causes of attrition in hospital-based violence intervention programs. And that was my capstone research. And I was doing a literature review and an evidence analysis. And I also got to learn from Dr. L.J. Punch, who does very similar work in St. Louis, Missouri, and work with the folks who are doing very similar, harm reduction and violence intervention programs here in Denver. So those were all really great experiences. I got to experience, I would say, several different factors of healthcare and health, which I'm very, very grateful for.